All right, let's go ahead and get started. Thank you, everyone. We really appreciate you taking time out of your busy day to join us for this webinar this morning, COVID-19, How to Survive and Thrive around Patient Engagement Best Practices. Just a few housekeeping items. This should be around 30 minutes or so, and if we have time for Q&As at the end, we will do that. You have the ability to type in some questions, and if we do not get to that, we will follow up with the answers via email in addition to the recording and the slides. So a little bit about Luma Health for those who aren't familiar. Luma Health is a total patient engagement platform that is designed for providers and patients, designed to really maximize patient outcomes. It was built because we're all patients, and we really believe that it should be easy to see and connect with your doctor and get the care you need when you need it. So our platform was built to meet all patient access needs and communication, anywhere from patient scheduling to patient communication, and really everything in between. So let's get started on the webinar. I will let the speakers introduce themselves. We are waiting for Dr. Jogi. He had a last minute thing come up, as I'm sure you guys all understand. So Dr. Akram.
Hi, my name is Tashin Akram. I am the Chief Medical Officer at Luma Health, and I split my time between working for the company and still practicing as a radiologist. And at my core, I love doing technology work, and so it's been exciting for me to work with Luma Health and trying to see how to use technology to be able to solve a lot of patient engagement challenges that practices see. And with us is Samantha, and I'll let her introduce herself.
Hi, my name is Samantha Gutzman. I'm the Chief Operations Officer at Alexander Valley Healthcare. We are an FQHC in Northern California.
And these are all kind of the learning objectives and key items we'll be talking about today. We'll really be going through the COVID-19 pandemic through these 5 stages that our data analysts have set forth for us. So I'll have Dr. Akram take it from here.
Perfect. Thank you so much. So we'll flip. Yeah, perfect. Next slide. So what I wanted to do is we wanted to describe some of what our data scientists and a lot of the folks that are really trying to think about what the country is going through, both at a very macro level and at a micro level, of how we are progressing through this pandemic that we are seeing, which is obviously very unprecedented. And so we thought it was a very useful exercise, not only for us to understand what's going to happen, but a way for us to share our learnings of how the country as a whole, and again, at a very macro level and a micro level, progress through how this disease comes. And so we broke it down into 5 different stages of how the disease will kind of start to set foot, and then it will escalate and de-escalate. And then what we really want to do is the real benefit of this is that we can understand that how, as healthcare providers and those of us who are engaged in delivery of healthcare, what we can do at each stage to make sure that we are taking care of our patients. I'm just gonna take a quick pause. Is there an echo, or is it just on my side?
I hear it as well.
Yeah.
All right, wait, let me
have everyone muted that is not speaking. Hopefully that'll fix it.
Or I can make, is it still there? It looks like it's still there. I can call in from my phone. Give me just 1 second.
Stand by. Thank you, guys.
Apologies.
All right, sorry. So is that a little bit better?
Yes, thank you.
Yeah.
Okay, perfect. Sorry about the delay. So what we're trying to show here is how we would foresee the disease kind of spreading and what really impact is on operationally and from a healthcare delivery standpoint for clinics in general. And I think what we want to do is we want to kind of share some of the insights that we're seeing as a lot of our clients kind of fall into different parts and what they're doing, and be able to help share some of our experience of how you as a healthcare providers can help to continue to deliver healthcare at these very challenging times. So I'm going to, and we'll dig in more deeply into each of these stages, but just to give you kind of an overall overview of it. So the beginning of it is what we've termed is readying for disruption, and this is where the virus is just kind of starting to peak, or it's at its acceleration phase, and this is where clinics are realizing that they're coming and trying to figure out to prepare what we can do to take on this. What are the new challenges that are going to be coming forward with this virus kind of starting to spread? Next, we kind of go into operation disruption. This really is where now the clinics are looking at to see, okay, who do we need to cancel? What do we need to do? What can we share with our patients at this phase? And then moving into the stage 3, and this is where a lot of the country is right now, is where most clinics are closed, and it has the greatest impact on the healthcare delivery system. And this is where the healthcare system is really being strained, where a lot of patients are very sick, they're admitted into hospital, showing up at the ER. And then we kind of transition into stage 4, which is where the infection rates are starting to go down. And then we can start thinking about how do we start opening up our clinics, and how do we start going back to being in a position of delivery care. And then stage 5 is where we have kind of exited the COVID infection. But now, what is it that we've, the different workflows, or what is it that we've taken away from this kind of experience that'll become the new norm for us? Whether it's telehealth or whatever it is that we've had to implement in the process of this, what is going to be something that's going to stick with us going forward. So that's kind of the overall overview, and we're going to delve a little bit deeper into each of these stages and see how far we can get through it. So go to the next slide. Perfect. So jumping into stage 1. So this is where, again, this is where clinics are getting ready for disruption. And you can see here, the map that you're seeing in front of you is of what we put in, overlaid our staging over the map of the US. And it helps you kind of understand where each state is based on our data and based on the data that we've seen from public sources. Now you can see the majority of the country is actually in stage 3, and there's very few in the stage 1. However, there are still a few states that are kind of getting into here, and so you can see they're kind of in the middle of America. And these are states that don't actually have a statewide mandate for social distancing or stay-at-home orders. And so, for example, we're seeing in Oklahoma over the past week there's been a 53% increase in the cases. In Arkansas, there's been a 60% increase, in Nebraska 74, and in Iowa 82. And so you can see that these are states which are kind of seeing the fruits, so to say, of not doing the social distancing, and so they're just starting to ramp up in their cases. And so they've entered into stage 1, and they're probably going to be entering the stage 2 very soon, which is which we'll talk about in a little bit, which is where that operation disruption comes in. So what are the kind of the critical needs in this stage 1? So first is a proactive outreach, and the second is a rapid two-way communication, and then the third part of it is kind of looking at ways to risk assess. So the proactive outreach, this a lot of it revolves around helping patients understand what's going on, especially not many states are at this phase, so a lot of the confusion and a lot of the fear that originally revolved around COVID when it was just kind of starting to ramp up was around, what does this mean for me? What should I be doing? How can I help, to keep myself healthy or those around me? And so a lot of the use case that we saw was around facilitating education of the patients. Because if you just go on the internet, you're going to find things that are truth and false, and it was difficult for the average patient be able to decipher what should I really be doing. You know, those myths about like drinking hot water or things of that nature, which didn't have a lot of science behind it, but became kind of pervasive amongst folks to be thinking as a way to, you know, prevent getting infected. And so in this early phase, the biggest use case that we saw was explaining or educating the patients, here are resources for you that you should be using to help you stay healthy. A lot of it was referring back to CDC, because in the early phase, not much was known. And so a lot of the word of CDC was what was really carrying weight. But just general practices that I think everyone knows now are standard in a way of preventing the infection spreading, but around keeping your distance from people. If you are someone who's expressing symptoms of cough or fever, then what you should be doing, how much social distancing you should have, washing your hands, things of that nature, of helping patients kind of be in the loop of where they should be going for their information and what they should know of how to prevent it from spreading. The second part of it is about providing provider critical needs. And this was really helping providers understand what are the needs of the patient. So the first solution that or the first use case that we talked about was kind of more of a one-way, being able to send a message and just let them know, hey, this is what the, you know, this is the educational material you need to help you get through this infection. But now what we want to know is that, okay, so now we've educated the patients, but we want to let them know, hey, what are we doing? And for the providers to be able to get some information back from these patients and be able to risk assess. So as we know, there are certain patient populations, depending upon your age or your pre-existing condition, are at higher risk of having a harmful impact from the infection. And so we've seen a great uptake in messaging, which can risk assess these patients. So asking them, are you having symptoms? Do you have a pre-existing condition? Are you of a certain age? So that the providers can then help the triage to figure out, hey, are there certain patients amongst my patient panel who I need to who I need to pay special attention to? And being able to do that in a two-way fashion, such that it's not just a one-way thing, but it's actually a way for them to be able to ask questions, because some of it's a very structured, being able to ask, hey, here are some questions to ask. But patients have other unstructured questions. So to be able to provide this communication capability that can not only grab structured data, being able to ask, yes, no, here are the certain symptoms that you're having, or here are the disease entities you have, but also other questions they may have that may not be able to grab that in a very structured way. And so the second need really revolves around getting data from patients. So now I'm going to pause there and turn to help you get just some real-time assessment of what folks are doing. And I'd love to hear what Samantha has to say. And then if Dr. Jogi is available now, I would love to hear some of his thoughts around this too.
Okay, thank you. This is Samantha. Good morning. Okay, so I'm sure, like a lot of you, we were getting new information and still getting new information daily too. So when this all hit, we followed the CDC guidelines. We had a script going not only in the phones, but we had them at the front desk check-in of how do you can screen the patient. And then we were able to take two separate, or split our clinic in half basically, and have a sick wing and have a well wing too, so that we could still see patients that need to be seen for acute reasons, new patients, OBs, anything like that, but we still could serve the sick population too. And how we developed it and going forward, because testing supplies were so short, we didn't have testing at first. The CDC was the only one doing this testing at the health department. So there was a lot of things developing in a short period of time too. So we were able to get some flu tests as well as the COVID testing. So since the influenza was still a I don't want to say a popular, but it was still out there. You could still get the flu. So we decided we had people coming in for symptoms. Let's test them for the flu first. If they were positive, then we can treat them that way. If they were negative and still had the symptoms, then we can escalate it to the COVID testing because we were so short-handed with the testing supplies. So it's been a lot of kind of rolling with the punches as things come up. A lot of things are coming out daily on changes that we need to make, people we need to notify on all the people that we're testing. So it's a lot of changes really, really fast. So we had to adapt and put some protocols in place. We also had to furlough staff as the virus spread into the United States and in California too, that we knew we were going to be impacted. The shelter-in-place order happened. We had to furlough probably 50% of our staff just because of the hit. Nobody was coming in for the visits. Then we had to adapt to the telehealth and telephone visits, which we initially started off with Zoom. But the patients were having trouble downloading, or it was taking a lot of time too. And then when Luma came out with their telehealth piece, it's a lot easier. All they need is internet. It's one click and they're in. It was a nice transition into a streamlined process and having something a little bit more easier, user-friendly for our patients too. So we've been rolling with it and, you know, getting in new information daily and seeing how we can adapt to it, tweak our workflows. Every day is going to be a change. So it's just us dealing with what's coming at us now. So we're anticipating a surge as other states are opening and people are getting restless, and you've seen all the protests and so forth. So there's a lot of pressure to get this, you know, taken care of, and people are out. So there's going to be a lot more patients that are infected, and we need to prepare for that as well. So we need to make sure that we have the staff in place in order to do that. We need to make sure that we have the testing supplies in order to do that. So there's a lot of stuff that we have to be prepared for just in case if there is a huge surge now that there's more testing and people are being tested more regularly.
Great. No, thanks for your insights. So now moving into stage 2, and I think Samantha started touching upon some of this, but you know, we've termed this stage the operational disruption, and this is really where clinics are now starting to shift their schedule, and they're starting to see how they can start coping with the waxing and waning demands on their services, and also some of the government mandates that are coming in. So you can see here the states in this stage are very few, only about 2 of them. But I think a lot of our states already had gone through this phase. And so we're going to describe some of the things that we've learned from our clients, what they did during this stage. And a lot of what a lot of our clients did during this stage helps them cope with the following stages that come up. However, I think it's still useful because we see, even though a lot of our providers or clients are actually in the 3rd stage, there's certain things we can still implement from things that other clients did who may have adopted certain practices early on in stage 2 that can, again, carry us through the following stages. So what are kind of the critical needs around in this stage? So first is it was because of this patient safety, employee safety, it was revolving around just shifting the schedule. And for most of the clinics, this mostly just meant was mass canceling patients. And the challenge around doing that is a lot of clients didn't have the ability to mass message patients. You know, they have appointment reminders in place or other kind of notifications that go out. But how do you, for example, I want to look at all the patients who are scheduled for, let's say I'm going to be shutting down services for the next 2 months or 3 weeks or whatever it is. How do I mass message those patients to let them know, unfortunately, we are closed? And then, and that's one piece of it. We're communicating to the patients that we may be closed. And then what we've also seen is that coming with this is that when the appointment rounds are still going out, a lot of patients are actually still afraid. So even if your doors are still open, a lot of patients are saying, I don't need to, I don't need my annual screening right now, or, the concern that I have, I can wait a month. They're scared of venturing outside their houses, and which is completely understandable. They don't want to go to a place where they're sick, or the other you may be exposed to other sick. So we've seen not only clinics reaching out to cancel appointments, but actually there's been a rise in general of those patients not wanting to show up for the appointments, and actually responding to those automated reminders that are going out to cancel their appointment. We've seen the engagement rates go up, so patients again are concerned, what's going on, what can I do? There are a lot of questions coming in, so we've seen a rapid uptake in the patients responding and patients reaching out to clinics through our messaging platform to be able to address questions. I'm having symptoms, what should I do? Understand what service lines they have available to them if they do get sick. And finally, as I think all of us are just living this, is that when we're either proactively canceling these appointments or we're seeing patients just not show up, this is definitely impacting our bottom line. And so there's been a rapid rise in clinics who are facing financial strains from this because they're just not being able to conduct business as usual. So now, moving on to the next slide, what are the critical needs for the providers? They kind of fall into three different categories. The first is around telehealth. The second one is kind of ongoing and continuing that scalable, large mass patient messaging. And the final of it is continuing to do some of what we were doing in stage one, is doing screening and then risk stratifying patients, helping to understand who are those patients that need the care right now and getting them to be able to deliver it. So now, talking a little bit about telehealth, and Samantha talked about this, we've seen a very rapid uptake in the need for telehealth, as I think a lot of them know, and I'll just quickly mention some of how telehealth has changed from a regulatory standpoint in the last 3 to 4 weeks. Is that one is CMS is now going to be reimbursing at parity with an in-person visit. There are a lot of regulations around where the provider could sit when they're doing these visits. They can now do them from the comfort of their home. You can even use non-HIPAA compliant tools, if that be, although we recommend you still use something that is HIPAA compliant. And the final is that the patients don't have any of that distance restriction. A lot of the restrictions previously were that patient could have access to care. They couldn't be really close to your clinic. So for now, you can actually do a telehealth visit with a patient that's literally right across from your clinic. But what we've seen is the use case around this has been now, once a clinic has been able to triage those patients to understand who is it that needs the telehealth visits and which of our visits can we still conduct over telehealth, because of course sickness doesn't wait. So just because COVID is out there doesn't mean you still have issues around other chronic diseases, and you still need access to care. And there's a very large amount of healthcare that can be still delivered. And so we've seen a very strong need from our clients to adapt telehealth rapidly, and not just rapidly, but how it can work into their workflow so that it can be streamlined, so that way when services lines do ramp up, that it becomes a solution that is something that they live by and not something just a band-aid they put on today. So in the next slide, we'll talk about how, for example, because this actually just kind of reiterates some of what we were talking about. I think one of the biggest needs right now is that telehealth is being used for a strong need, but I think what will be a lasting impact from this is that it will be a place to stay for also patient convenience. So what is the core of our solution, which we talk about in the next slide, is that to make it very streamlined for the patient. What we have seen talking to a lot of our clients before we released and optimized our own telehealth solution was that it was difficult for patients. There's a lot of hurdles on both the patient side and the provider side, particularly on the patient side, because they may be only doing a one-off visit, and making sure that the patient actually has easy access to the telehealth room. And so we've taken our platform in general is what we call appless, meaning that it doesn't require the patient to download any iPhone app or Android app or whatever it is, or even an app on their desktop if that's how they're going to be engaging with their provider. They can do it just from a simple web browser access, or a lot of our messages actually go out our plain text messaging, and so they can interact with it. And what this really does is it helps make sure that we get great response rates and that we really leave no patient behind. And so we took that same kind of experience and same kind of philosophy and applied it to telehealth, where the patient can access the providers without a need of an app. So it's a very simple experience. The patient gets a message on their phone. As you can see on the screenshot, they'll get a little text message, and they can go and click on that text message, and then it opens up a web browser on their phone, and then it lets them conduct that telehealth visit. Our service is compatible over a wide variety of phones, tablets, and desktop computers, so making sure that we can give access to everyone out there. But it wasn't just we wanted to focus on the patient experience, we also wanted to focus on the provider experience, making sure that it's also easy for our providers, because as we've seen, because clinics are actually closed, providers are actually doing a vast majority of the visits from home, and it's hard to, whereas in the baseline setting where they may be doing this from their clinics, they will have access in their clinics to the appropriate laptop, which has a camera and a good mic on it, or on their phone, or whatever it is. So we wanted to build a solution that was going to be able to not only scale when we return to the new normal and be able to do telehealth visits from clinic, but they also allow providers to be able to do it from their home and not rely, for example, to be able to drive these visits from their EMR or wherever they spend their time. And so you can see kind of the simple experience that we tried to build for the provider, where they can get a streamlined view of their schedule on a daily basis, being able to click one link to know that here's a session that's going on with my patient, and it launches right on top of their schedule. It will launch the video experience, and they'll see themselves in the corner. And then in real time, they can kind of be able to drive these experiences just having access to a web browser with a camera and a mic. And so what we've seen is there's several different use cases, but we can see as that going back to the mass communication process of it is that the volume is starting to rise, and it's kind of mimicking the rise of an infection as it takes kind of a stronger hold in this, what we're calling the operational disruption phase. And again, a lot of this messaging, first it revolved on just kind of education, but now it's revolving around scheduling workflows, mass canceling patients, screening patients to see, hey, which of these patients can I switch over to a telehealth visit? Which of these patients should I still be seeing in person? Because a lot of clinics, of course, are still open, but they're trying to limit their service line to only patients who strictly need to be seen in person. And then kind of walking into continuing care, a lot of clinics are starting to think how they can use this mass scalable messaging service to be able to still provide care for those patients who don't need the care today, but have a chronic disease. And so we want to be able to make sure, for example, let's get them rescheduled 2 months later when we hope to be open. So these are kind of some of the different use cases that we are seeing. And what's been really telling for us is that when this is kind of hitting the ground, so to say, it's been a very powerful experience for our providers to be able to put together the mass messaging capabilities with the telehealth experience, such that you can marry the two together and be able to drive a nice streamlined process where you can help and identify in an automated way who are the patients that are scheduled for an in-person visit, who of them can be good candidates to be telehealth, and then being able to convert those in an automated way into televisit, and then being able to streamline the messaging workflow that happens after that conversion happens, such that then the patient can conduct that visit. So you can have, even though there's a lot of operation disruption that's happening for clinics, it can minimize that disruption and be able to streamline the conversion of these in-person visits into telehealth visits. This is where I'll pause and then hand it over to Samantha to see, kind of, again, share some of her experience around what she is seeing and what kind of practices she's benefiting from during this stage.
Yeah, when we started telehealth, it was mainly for the medical providers. So they could see their patients that we needed to, our chronic condition patients. And then we kind of expanded out and went into behavioral health services as well, which that's where we really saw the impact, if you will, on the telehealth. Behavioral health is one of the highest no-show and cancellation rates. Since flipping over to telehealth, we've seen a huge swing in patients actually keeping and holding their appointments too, because they can do it from home or wherever they are. the ongoing communication that we have for our telehealth visits. We have MAs and assistants contacting patients. We're actually screening them. They're doing intake, if you will, getting consent for the telehealth and setting it up for the provider so that when the time comes, then the patient and the provider is ready for it. So the pre-screening is very much key here because patients will say that they don't have any other needs or anything like that. And then when it comes up to speaking to somebody in clinical, things might arise there where it could navigate this appointment to whether they need to come in to be tested or they can still continue their telehealth. So the pre-visit screening was crucial for us. And prior to us going live with Luma, we'd have to contact them, make sure they could download the Zoom app and get them on there to see if they could see stuff. So it was a lot of transitioning, as you will, if for patients as well as us and our providers, getting and going from this stage of Zoom into now Luma, and how Luma has taken away a bunch of the steps for our clinical staff, for our phone staff. So, and it's allowed to streamline that process so that it's kind of very, very easy for our provider to get in. It's super easy for our patients to actually click the link and just be there. And all they have to do is allow the microphone and camera on it instead of going, downloading, putting in their PIN or whatever they need based on the type of phone that they have. So it's kind of propelled us into a different stage in how we're seeing our patients because we can see more, there's less time for the technical support, if you will. It allows the patient and the provider to connect faster.
Thank you so much for that, Samantha. And it looks like we are actually at about time. And I think we definitely want to get Dr. Jogi back on here as well. And unfortunately, he had something that came up. So I think we're going to do a part 2 of this series and finish up with stages 3 through 5. So we will follow up with everyone with the recording of this half and when we can finish up with part 2. So I see we had a couple questions and I will again follow up with those as well. So we really appreciate everyone taking the time and we hope you have a great day. Thank you guys. Thank you, Dr. Akram and Samantha.
Thank you.
Thank you, everyone.